Local Memphis Live continues with your host, Amy Spiropoulos.
October is Breast Cancer Awareness Month, and one of the best things a woman can do for her own health is be informed. Joining us this morning from UT Plastic Surgeons is Dr. CEDRIC Hunter to discuss breast reduction surgery. Good morning, CEDRIC.
Good morning. Good morning. How are you?
You come with the pink bow tie, the pink pocket square.
Yes, breast cancer awareness. It is that month.
It is that month. So let's start broad. What exactly is breast reconstruction surgery?
So, with it being October, obviously breast cancer awareness is the most important thing to make sure you do your screening, early diagnosis. But with that, a really important aspect of the whole treatment of breast cancer is breast reconstruction, which is the whole goal is to restore basically the shape and the form of a breast so that women feel comfortable in clothing, whether it be bathing suits, etc., so that you can kind of get back to life as normal before you had the breast cancer diagnosis and underwent whatever type of treatment for breast cancer that you needed to have.
And one of the specific kinds of surgery that is becoming more popular these days is the DIEP surgery. What exactly is that?
So, I'll speak broadly. So there are two general types of breast reconstruction. You either use something that you take off a shelf, implants, expanders, or you use your own tissue. Sometimes people use a combination thereof. But for when you want to use your own tissue, the DIEP is where you actually can take tissue from the belly, and that would be the same tissue that you would use for a tummy tuck. So the same stuff that I would cut out in that kind of cosmetic procedure, I look for little blood vessels that are in it, and I take those up, and I go into your chest, and I sew those blood vessels together. So that way, to reconstruct your breast, I'm basically using your own tissue. I'm using your fat if you have a little extra in the area. So the breast is then soft. It can hang like a natural breast. And you don't have kind of the long-term problems that you do with implants, things like contractures and ruptures and leaks and things like that. So it's kind of a win-win. You get a tummy tuck and you get a breast reconstruction.
It is. My mom had one. We were talking about it during the break, and my mom had the DIEP, and she's always saying, how flat my stomach is. So
yes.
Small benefit. Who exactly is a good candidate for that specific kind of surgery?
So for that type of procedure, it would be an individual who has a little bit extra kind of around the belly area, something that I can actually pinch, that I can actually remove, and somebody who can undergo a prolonged procedure, because the procedure is longer than implants. It takes several hours to do. It's an all-day procedure, but for people who can tolerate that procedure and who can go through the recovery period, which is several weeks, a little while longer than the implants, it's a fantastic procedure for people who are able to undergo that. And I would say, I think the big thing with all the awareness is just having people know that that is an option. Because some places, particularly in some areas where they don't offer that, you may go to a surgeon for reconstruction, and they may not tell you that that's even an option for you. And it's not because you're not a candidate; it's because they can't offer you that particular procedure. So it's important for women to be aware of all the different types of reconstructive options that they have, so that you can pick what's best for you as a cancer patient.
And you mentioned that recovery is a couple of weeks. What is the recovery like?
I usually tell patients about 6 weeks for no heavy lifting, which is about the same thing that you'd get if you had a tummy tuck, right? And it's because you don't want to do a lot of heavy lifting and stress the sutures that people place into, basically, because when I take the tissue from the belly, I then have to pull you tight. And so if you do a lot of heavy lifting, you can kind of pull on those sutures. So I want you to take it easy for a little over a month, and then after that, you're free to rip and run and do anything you want.
And with the actual results that people see, when people come back and say, wow, thank you, what are those results, and what do they look like? What does a positive experience look like?
Most people are very, after having to deal with the breast cancer, you're looking for some benefit from it. So like your mom, most people are very happy with their abdomen, right? Because you had a little area that had a little extra push. Like, how do I get rid of this? People often, also when they come with family members, they're like, well, can I donate? We haven't gotten to that point yet. But that's really a big benefit.
I'll be waiting for that part. Thank you.
There's a big benefit that you can get rid of some of that extra tissue. And then, like I said, like the breast is actually, it's soft, right? So it feels soft. It feels just like you. As you gain weight, it gains weight. As you lose weight, it loses weight. As you kind of age, it kind of ages with you, and you don't have to worry about coming back in for imaging later. You don't have to worry about coming back in to feel whether or not the implant is ruptured, if it's firm, any of those types of things. And I do implants as well. I think implants is a fantastic option for some patients. But for patients who have radiation or who are a little bit kind of on the larger side, then using your own tissue it's really hard to beat that.
And that's exactly, my mom's a 24-year breast cancer survivor, had implants originally, a lot of radiation there. When she eventually had to get them removed and replaced, opted for the DIEP, says it's the best decision that she ever made. If someone is interested in this surgery, why should they pick you or a university plastic surgeon?
Well, I'd say the main reason to pick, particularly someone who's in the Memphis area, the main reason to pick me or us at University Plastic Surgeons is because there's no one else in the area that does it. That's part of the reason why I elected to kind of pick this place. The closest place to get this is about 3 hours away. Right? You'd have to go away to Nashville to get this done, or people go to like Atlanta or some other area. So in this area, this is the center. So this is something that I'm trying to build, something that I'm passionate about, and I'm just trying to get the word out to let women know that this is an option and that they should be seeking out to have all of their options. You know, the numbers are really less than 50% of women actually have a breast reconstruction, and less than 25% of women are actually aware of all of the options that they can have for reconstruction. So it's just important to kind of know what all of your options are.
Amazing. Dr. Hunter, thank you so much for being here. We appreciate it. Thank you.
Absolutely.
We'll be back with more Local Memphis Live coming up next.